So that's important. Many causes of resorption. Tooth loss is the most important. Periodontal disease, infection, trauma, osteoporosis. This is systemic disease can cause that. Pre-prosthetic design and function. Sometimes ill-fitting denture can cause trauma to the alveolar bone or resorption and other things. Before the implant, I thought the alveolar bone is very tough. It's not. When you do the implant now, the temperature is 100 and 114. The bone if you drill, you have to have, when you drill to do implant, you have to have a good cooling system. And you have to go slowly, and you have to use sharp instrument, all to reduce the heat that will be generated when you're drilling the bone, because the bone is very precious. And if the heat's too much, lead to bone necrosis, and you don't see it immediately. The heat trauma, you see it later when the failure of the implant.
Is that because it's porous?
No, because it's very sensitive. It's very sensitive. It's very delicate, and I'm teaching people, especially when they do extraction, be gentle. I know that bone is very precious, and use less trauma. Make all the trauma, especially if you have upper molar, first molar. Try sectioning the tooth. Upper molar has 3 roots. And almost always when they do without extraction, they fracture the buccal plate. And sometimes it goes with it. And sometimes when they do the wisdom tooth, they fracture the tuberosity. So if you can do sectioning the tooth and separate the roots, it will easily be removed. And use gentle force, don't damage the alveolar bone. So the alveolar bone would be very sensitive to that thing and get resorption. Why it's important to preserve the alveolar bone? Aesthetic, because without the alveolar bone, you lose the vertical dimension, you lose the support for lip, cheek, lips, both of them upper and lower. Sufficient bone required for osseointegration. Osseointegration when you put implant. The whole process of the bone holding the implant called osseointegration. We saw with the last lecture when osteoblast will grow and goes on the fibers. Stability of the denture. If you have good denture, almost always you have good. If you have good alveolar bone, almost always you would have good retention, and good stability. If you have flat bone, that's the worst. That's very difficult. That's why you have to do different things. You have to do bone graft, or you do large, multiple implants to do overdenture. So once the alveolar bone lost, basilar bone may be affected. Even the basilar bone would be resolved too.